Hello, I'm Dr. Justin Deary. I'm here to speak about the vital connection between your blood, your bones, your muscles, and your mind, and how we get to the root cause of health conditions and help to rebuild resilience in every human being that we come in contact with. So, my only disclosures are that I'm the owner and partner at the Deering Clinic, partner with my lovely wife, who has a background in cardiology uh, and as a nurse practitioner. She spent about 15 years in cardiology as a nurse and a nurse practitioner over those years. And about 3 years ago, we both started studying longevity and attended conferences and webinars on peptides and anti-aging medicine and all that wonderful stuff that is new in the world of medicine and functional medicine, if you will. Um, and she decided to take me up on the offer for us to practice together so that we can help people in really really big ways, whereas we couldn't in our own little camps in medicine and holistic medicine and this sort of competition. It doesn't need to be that way, and we realize that we can practice together, and it might be fun or we might kill each other, but so far we've been having a great time, and we've seen a lot of really awesome things that just keeps our candle lit for helping patients in the deepest way possible. So um, at the Deering Clinic, our model is built around rebuilding and maintaining resilience. Um, we operate on the idea of there are four pillars of health: your blood, your bones, your muscles, and your mind, with longevity being the goal. There are very simple solutions to common health problems, very simple solutions to healthy aging. It's just a matter of cutting through the noise of the wellness world and and realizing that the majority of what can be done to help us to live into our golden years and enjoy our retirement is really right between the ears. And the best medicine is often free. We don't think about that. So I'll tell you a little bit about why I got into this and share a similar patient story that we've seen in our office recently. So uh, when I was 12 years old, I had a big concussion and I was on the football field. And weeks, months passed after that, and I began to develop headaches and brain fog and chronic sinus infections, which I thought and everybody thought at the time was the reason for my headaches and my brain fog. I didn't know what I know now at that time, but after going to three to four physicians and doing rounds of antibiotics and steroids and seeing some improvement in the condition, all for it to get worse when all of that wore off. That progression over 3 years until I was 15 was awful, and I did not enjoy that time of my life because I was suffering, and we couldn't find the root of the problem. And so ultimately, I ended up with a CT scan that said I had a deviated septum in my nose, essentially, and that was probably causing stagnation in my sinuses. And go in with surgery and cut my face open and correct that deviated septum, and all would be well. So I signed up for the surgery, but it was going to be 6 months. So my grandmother said, "Well, why don't you please just come to my chiropractor?" And I had always resisted because I didn't want a big burly man cracking my neck. But my headache was so bad at this one particular moment that I agreed. She took me in. I got a few adjustments in that first week, started to feel some things shift. And in the second week, my sinus problem went away. And then my headache started to dissipate over the next few months until all of a sudden it was cleared up. And so I was frustrated that that wasn't the first thing that I did. Number one, I didn't listen to my grandmother. I was resistant, like most men. And anyway, uh, I found it my calling ultimately after studying several other things about organic food and power of plant medicine and some of these other things that were coming on to the scene back in around the 2000 mark, around the year 2000. And ultimately my story has been walk through my office and many times with different patient scenarios, but this one is a striking example of this 15-year-old girl who wants to be a professional figure skater and works her tail off to do it. And this high performance athlete, and she had a chronic headache syndrome that lasted for 6, 8 months, something like that. And the coaches were pressuring mom to put her on medication and go to this doctor, go to that doctor that we know, and they'll figure out a solution. Well, ultimately, headache medicines and those things didn't help, and the last resort was to put her on to an antidepressant. 15 years old. Mom says, "My daughter is not depressed. I want to find a way to solve the problem. Like, what is the problem? Why do we have headaches?" So a colleague of mine treated her for several weeks, and he's a great doctor. So he, you know, normally would have the headaches under control, but he assumed that there was probably a neurological connection. So he sent her to us. And so we applied our four pillars to this young lady, and within a month, her headaches are gone. Did some blood work with IV nutrient therapies to help put things in her system that would accelerate her healing, pulling off inflammation and helping tissues to repair, put her in the hyperbaric oxygen chamber, and perfuse the whole brain and the body with extra oxygen to further pull off more inflammation, to help nerves reconnect. And of course, manipulation of the spine, rehabilitation, and a number of other tools, acupuncture. But it took us 4 weeks to change this girl's chronic headache syndrome, and they were going to put her on antidepressants. Was the solution? She's being pressured, and mom is so happy, and of course the daughter is very happy to not have headaches. But we share this story because what happens in a lot of people who develop headaches or any other problems with the neck or brain or whatever, we've had whiplashes, we've had injuries. Uh, she injured herself by twisting her ankle on the ice and falling down and landing on her shoulder. When I asked them, does she have a concussion? No, she just hit her arm. She fell. She didn't hit her head on the ice. Well, you don't have to hit your head on the ice. You don't have to have a head injury. It's a whiplash that is the cause of many concussions, not just the impact to the head. When you whiplash your head or have a head impact, you ultimately have a whiplash. You shear your brain stem away from your cortex. This very important area called the cerebellum. You see all these red tree-like looking things inside the cerebellum. Cerebellum is our coordinator, has a bunch of dense nuclei that communicate everything from our spine to our feet and our posture and our balance to our arm motions to the dexterity of our fingers, even the coordination of our thoughts and emotions happen in this little brainstem region uh, area. And if we disconnect the processor from the coordinator, then we're going to have brain fog, problems thinking, attention problems, emotional problems. Um, and we understand this a lot better now because the state of neurology understands the mechanisms of concussion and injury, but that extends to everyone, not just brain injury people. Our brainstem and our cerebellum contain more neurons than the entire brain cortex. So if we damage them in any way, there are many ways to damage them: toxins, injuries, um, lack of activity, ultimately stimulation, will cause these areas to have problems. And so, it's not a fancy helmet that's going to prevent concussions. It's ultimately neck strength and neck mobility um, that will help us to reduce the risk of concussions in the future. Um, when we go try to figure out a problem that we have, we go to Dr. Google, and we often misdiagnose ourselves with the probability that we'll develop premature death. Whatever your symptom is, that's where the rabbit hole leads. So the world of wellness is confusing. It's a big, vast, wide world of internet information about superfoods and fad diets and the newest supplement. There's a new one uh, in your inbox every week, maybe every day. We have social media influencers. Patients come in and say, "Hey, I saw this thing on social media. Do you think it could help me?" I say, "Well, yeah, maybe, but I think we have something that is much more appropriate. And so we'll, you know, field those questions a lot. If you go to your doctor, you have a symptom, you get a prescription, and they tell you to eat good and have better exercise. And people walk away saying, well, "What does that even mean? What diet should I follow? What kind of exercise?" So we are here to help be the Sherpa for our patients so that they can climb that mountain of health and longevity. I want you to know that your longevity begins right now. The fact that you've thought about it, you'll never be able to quit thinking about it because that is what we are all trying to do. We're trying to live into our retirement years, be able to play with the grandkids and enjoy ourselves instead of the month after we retire. I hear the story all the time. You know, I've been retired a month and I get in an RV and I go travel across the country and I find out I've got prostate cancer or some other terrible thing. Your brain directs every aspect of function in your body and your mind. And we really need to only master three simple things to stimulate our brain, our body, and our mind. That is oxygen, nutrients, and stimulation. Every nerve and neuron needs oxygen, nutrients, and stimulation. For oxygen, we simply learn to breathe well. Most of us don't do that well. Best medicine is free. It's your awareness. It's between your ears. We need to eat nutrients. We need to eat fat. We need to eat meat. We need fibrous vegetables and a few carbohydrates. Obviously, limiting sugar. That's the first step. Get rid of your sweet tooth, and many things will happen for you. Stimulation is not just about exercise. It is also breathing awareness. It's diet stimulation with good nutrients and good gut function. And stimulation is all about balance, timing, and rhythm. Again, our four pillars are our blood, our bones, our muscles, and our mind. Our blood needs good quality chemistry, needs good nutrients, needs good blood volume. We need a good balance between oxygen and carbon dioxide. And when it comes to our structure of our body and how we move it, we need our bones to have good structural integrity throughout our whole skeletal system. And we need good mobility and flexibility. We need to experience every range of motion that we possibly have as human beings. And we need to exercise those muscles that are associated with it. When we do that, we stimulate our brain. We have better quality blood. We have better energy production. We have better circulation. We have better joint health, mobility. We even produce growth hormone when we stimulate our muscles, specifically with weight training and trying to progress ourselves. And then we have the mind. Might be the most important pillar here because your mental awareness and your flexibility creates connection with yourself, with gravity, with your environment, with the people that you love, so that you can have safety, and being well oriented to your environment is critical. As we age, we lose the ability to dilate our blood vessels. We build up plaques, uh, and that's referred to as atherosclerosis. You get heart disease. So as we age, we lose 85% of our ability to make nitric oxide, which is the thing that helps our blood vessels dilate. And it's not from a lack of beet juice, although that is helpful, or the fancy supplements that you see on the shelves. Uh, but it's a number of factors. It's chemistry and quality of our blood and how we breathe. You know that nerves cannot function without good blood supply. If those blood vessels lose their ability to dilate, then blood vessels start to shrivel up, specifically on nerves. And we start to develop problems with those nerves communicating. At the end of the road, that's called neuropathy. We have many neuropathies. Alzheimer's and dementia is essentially a neuropathy of the brain. Those nerves start to shrivel up. They don't replicate themselves well. The genes get all screwed up. And it's driven by inflammation. It's driven by stress, strain, poor diet, poor lifestyle, lack of oxygen, nutrients, and stimulation is what that is. Those nerves are not getting oxygen or nutrients, and they can't process the stimulation. So they'll end up shriveling. We'll develop neuropathy, pain in the toes, legs, fingers, bad brain function, and then everything else is downhill. So what we do know is that there is an energy producing molecule, a nutrient that our body assembles so that we can put it into the pipeline for making energy. This is called NAD, nicotinamide dinucleotide. Uh, we lose 50% of our NAD levels between the ages of 40 and 50 years old. This loss of NAD in all of these organs, you can see the stats over here. In our heart, we lose up to 70% as we age. In our brain, we lose up to 90% of NAD function, which drives the cellular metabolic process and activates nitric oxide for better blood vessel dilation, mitochondrial health for energy production. If we start screwing with the mitochondria's ability to make energy, we start misfolding proteins, we start expressing bad genes, and then we get disease. So this loss is responsible for this loss of NAD is responsible for cardiovascular wasting, muscle atrophy and fatigue. You see in Granny as she ages, nerve wasting leads to Alzheimer's and Parkinson's disease. You can scan this QR code right here and read this very fascinating article that this image comes from about NAD. Um, and we can supplement it a little bit, but running an IV occasionally is huge for those of us above 40 and 50 years old, and it will help us to be healthier. So I'll just say that this very important figure in the world of nutrition authored one of the first books on nutrition and physical degeneration in 1939. He was a dentist, orthodontist, Weston Price. His goal was to figure out why these Americans that he saw had terrible teeth. So he went to study the indigenous populations around the world. It was at the time of flight travel. It was just beginning around those years. And so he went to study these remote populations to find out what made their bones and their teeth perfect and their structure perfect. And he assumed that it was because of their vegetarian diet, potentially. But what he found was most of these populations actually ate a lot of meat, a lot of fat, vegetables that were in season, because that's the way that we are made, right? That's the way we evolved. And so one of his quotes says that since our orthodox theories have not saved us, we may have to readjust them to bring them into harmony with nature's laws. Nature must be obeyed, not orthodoxy. Orthodoxy might be, institutions like the USDA food pyramid, which is awful. So I want you to do a breathing exercise because this is your free gift. If you don't breathe well, most of you don't, then you are going to have problems with oxygenation and windup of our brain when we breathe from our neck and we find ourselves having to take deep breaths oftentimes. That's because we're not breathing well. So if you practice it, it will become second nature to take good big deep breaths. So right now, let's practice what we need to do multiple times a day to have better health and better longevity. I want you to work to build this into your daily routine ASAP. So we're going to sit in neutral spine, which means we sit up nice and tall. Our shoulder blades are back. Our chin is tucked a bit. And we're going to put our left thumb on our belly button, which our hand will sit just below the belly button. Our right hand is going to go over our heart, like the Pledge of Allegiance. And you're going to feel your belly rise and then your chest rise. Breathe in through the nose and out through the nose. You're going to do this for a count of 4 seconds in and 8 seconds out. If you've done that 1 or 2 times in this neutral position, we can rotate our head right, tilt our nose towards the shoulder, maintaining our good posture, breathing in and breathing out for 8 seconds. And we can do the same thing with our head rotated to the left. The goal is to feel the rhythm of your belly rising, then your chest rising, your chest falling, then your belly falling. And we want to gain the awareness of our breathing so that we can do it subconsciously. So sit with that for a minute. Remember that. Take a picture. Do it before you go to bed tonight. Do it when you wake up in the morning. Set a timer and do it multiple times throughout the day. And if you don't, we end up with a number of things that can lead to chronic pain and depression, and all chronic disease has a root in one of these areas. Mental and emotional stressors, sedentary living and deconditioning, eating refined sugar, flours, oils, losing sleep, inflammation, genetic problems come out to play, obesity. All of these things create free free radicals, prostaglandins, and cytokines, basically associated with inflammation and mm, degradation of tissue in the body. And what that leads to in a country like ours is 30% of people in America are living with chronic or severe pain. Another very large percentage is going to develop or has cancer, heart disease, and diabetes. That is like 200 million people in our country. This is an epidemic and it's a problem. So, what happens in chronic pain? We get a pill. And opioids have become the number one killer and the leading cause of death for Americans under 50. If you don't die of one of those terrible diseases later in life and you develop pain when you're under 50, you very well might get addicted to opioids. Now, here in this country, we did a pretty good job between 2017 and 2019 of leveling off the U.S. drug overdoses by changing the regulations of how many opioid prescriptions could be prescribed and the whole regulation of that system. That was great until the pandemic hit. And then we saw 40,000 more people per year dying in 2021 and 2022 from drug overdose deaths. Around 75% of these overdose deaths are reported to be associated with opioid addiction. How do we get out of this mess? Well, integrative medicine holds the key, I would say. Chiropractic should be the gatekeeper, in my very humble opinion, for anybody in pain. Medical teams have many interventions that are not medication based, that are not surgery based, that are not steroids that are going to degrade your joints. Physical therapy, rehabilitation, acupuncture is phenomenal. Uh, Yoga therapy, and behavioral medicine. That's how we change it. We work on our mind, body, soul, and spirit that makes up you and, and those that you love. So you can scan this QR code and read Harvard's review on when back surgery is necessary. Pretty important one because surgeries often fail to fix the problem. Why is that? Probably not getting to the root cause with the surgery. Dr. Atlas in this Harvard review says your pain is decreased by 50% most of the time, and the relief may only last a few years before the pain worsens again. Standard of care in low back pain, disc problems, radiating pain down the leg is is starting with steroids. So if you have a intervertebral disc herniation before they do surgery, they're going to start with steroids. Okay, you get a good short-term pain relief for most people, but ultimately has a side effect of worsening the tissue um, function, and you don't fix the root cause of the problem. So therefore, the thing that created the problem in the first place still exists, and we end up with nearly 50% of people going on to require surgical intervention for disc pain and herniations. So what is better is rehabilitation, regenerative medicine of all sorts, stem cell treatments for regeneration of tissue show that 80% have long-term relief with one injection of stem cells in and near that back where the disc is herniated. It's nowhere near the cost. Might sound expensive, at first sight, but it's nowhere near the cost of lumbar fusion surgery, which is $100,000 plus hospital charges. If you're on Medicare, they cut you a deal, 65K, but insurance pays for it. So why would I come out of pocket to pay for something that would rehabilitate it and regenerate it when I can just go have a spinal fusion? Well, if you go have a spinal fusion, 50% pain relief. There's a large chance of failure, making it worse. It's very expensive on our healthcare system, maybe not on your wallet. And it carries a mentionable risk of death. With a stem cell regenerative treatment, there is way less risk, almost zero risk of adverse events. I want to leave you with a few things that your brain is a goal achieving machine. It gives you exactly what you expect. There's no distinction between mind and body. We need to learn to move through stressors, create better heart mind coherence, happiness versus suffering. They both exist at the same time all the time. Happiness is a free choice. Suffering is a free choice. We can decide what we want. I want you to read Lester Levinson's work in the Sedona method for choosing happiness, and that will help us have better longevity. You can scan that QR code and go to our website and request information on the Sedona method, and I will send you a PDF of the four pillars. Like I said, I think the mind is the most important pillar to work on because it brings you awareness for all the other pillars. You get what you expect. You're the master of your fate. You're the captain of your soul. Happiness can't be pursued without suffering along the way. Um, so we need to gather our energy production system, which is breathing and intention, body awareness, visualization techniques, practice of self compassion. Take a moment and hold on if your mind is stressed. You will push forward and we will be a better community. And we're all in the same boat. Create a rising tide so we can all have gratitude, wisdom, love, and compassion. And I'll say that no one will ever be more invested in your health than you. Listen to your body. Do not entrust it to others who claim to have the answers, but have their own agenda. So if you want to follow us, you want to get more information like this, I am educating as often as I possibly can through our newsletter. So if you scan this QR code, you can sign up for our newsletter. Just scroll to the bottom of the page, and you will be put in touch with our weekly weekly and monthly newsletters that you hopefully will find compelling and helpful. All right. So thank you all, and I appreciate your time and attention.